Hey everyone, this is day fifth of my post trans-PRK cross-linking surgery. Just wanted to give an update how things are. As you can see, I'm not wearing those now blackout glasses anymore, and that's because my eyes are no more sensitive. Well, I would say they're about 80% less sensitive to light than what they were before. Um, I'm able to, move around in the house without needing these glasses. Um, Also, I've noticed my vision has vision feels a bit sharper than how it was before. Like I can see a difference with my vision now. I further away, things look more sharper, more crisp. I do see a lot of I do see some haze, like uh, uh, like ghosting. I see ghosting, and but I think that seems to be a normal part of the surgery recovery, and it's just going to get better eventually based on what I've done my research on. Um, Other than that, what I've also noticed is I feel like my far-sighted vision has become worse. So when I'm trying to read things on my cell phone or on a book, it's not crisp anymore. I have to really wiggle around my phone trying to get the best angle to see things more clearly. And maybe it's just secondary. It's just what do you say, a side effect of the surgery, and it's just gonna get better. But then I've also read on Reddit that people end up having worse close-up vision than how it was before. It's just the nature of PRK. I could honestly care less. I think the this way I probably end up using my phone less, I guess. Uh, Other than that I did not really have any pain. Uh, I've not experienced pain in the last 48 hours. Dry. I have this, like, I have been keeping on with my eye drops regimen, following them to the T. So I haven't really experienced any extreme dry eye symptoms like how I had experienced in the first 2 days of surgery. So that's that. Uh, Other than that, day after tomorrow is my bandage lens removal. So again, looking forward to that. Uh, I'm really hoping that once the lens is removed, the vision might become a little bit crisper. But then I've also read elsewhere that that may actually not be a possibility. My vision might get worse after taking out the bandage lens, and may take a couple of weeks for it to stabilize. But we'll see. Uh, yeah. Oh yeah. Someone the other day asked me how was my vision before getting the surgery done. I thought I should cover that, or should I make a separate video for it? But well, I'll just cover it for now, and people ask it again. I can actually make a elaborate video explaining everything what I've done, my research, and my diagnosis. So prior to surgery, what doctor tells me that my vision was 20 by 400 in my right eye, and 20 by 50, yeah, 20 by 50 in my left eye. My corrected vision was 20 by 20 by 25 in my left eye, and 20 by 20 in my right eye. uh, I and And from what I have been also told that I do not have keratoconus on my in my left eye, and that was one of the reasons I did not get. Oh, that was the reason why my doctor decided against doing CXL in my left eye at the last minute. He was going to do it. He said that he's going to do a milder version of it, but then he backed out during surgery, saying that it's invasive and it's not required at this point of time. And if in future, if he sees any keratoconus in my left eye, then we can cross that bridge later on. Um, but yeah, my last checkup with doctor. Oh, by the way, the doctor which I where I got operated at was, oh, the clinic where I got operated at was Pacific Laser Eye Center. They're on West Broadway, Vancouver, BC. It's in Canada, and I think they were great. Doctor Lin, who worked on my eyes, is an expert on this type of surgery. He's pretty well known in the industry, and and uh, and the laser he used was Schwind Amaris. Is that how it's pronounced? It's spelled as SCHWIND Schwind Maris 1050 RS, which is the best laser in the industry apparently. That was the laser used on my eyes, and yeah. So, anyways, I'm going to make a elaborate video about this later on, but just want to answer some questions based on feedback I had from some people who watched my videos. But yeah, long story short, Vision is doing great. I I'm looking forward to even better Vision as the days approach. My last recorded Vision on day two was 20/40 in both eyes, which was slightly worse than 20/30 on day one or after right after surgery. Uh, but I know that vision fluctuates quite a bit after a PRK is done, so we'll see how it goes. Um, if, if you guys have any questions, leave them in the comments and I will address them whenever I can. Thank you. Take care. Bye.